Welcome to the Global Challenges interview. I'm here at the Royal Sussex County Hospital talking to Professor Mahmood Bhutta. Professor Bhutta works in the ear, nose and throat department. He is a professor of ear, nose and throat surgery at the Brighton and Sussex Medical School. Professor Bhutta, tell me a little about yourself. We haven't met before, but I know that you do work close to Global Challenges. How did you get here? What do you do?
So thanks, I'm Mahmood. I'm, as you said, an ENT surgeon. So obviously I've trained clinically to be a doctor, to become a surgeon, to specialise in ear surgery in particular. But along the way, I've also undertaken research, and I've got research interests in global ear disease, managing ear disorders around the world, and I've worked in many different countries to develop capacity. But I've also become interested in particularly our supply chains in healthcare and the issues associated with that in terms of environmental harm and labour rights issues.
And you recently, I should say congratulations, you recently were awarded a professorship for the work that you've done. In your professorial lecture, you referred to some of the difficulties that you've had in Britain becoming a doctor. You've spoken at time about that along the way it wasn't always easy. But nonetheless, you decided that you would become a doctor. What were the difficulties? How did you negotiate those before you decided to do what you now do?
I think a lot of what you choose to do is about role models and seeing people that you think I can follow. I could be those. And growing up, I had let's be honest, I had a good environment because my parents were supportive of what I wanted to do. And although there are problems in the UK, it's not as difficult as some other countries. I'm just honest with that. However, I was different because my parents were immigrants. I grew up in a council house. We didn't have a lot of money. I didn't have many role models around me. I didn't actually think I could be a doctor, and I wasn't actually encouraged that much. People suggested that maybe if I'd worked really hard, I could do something related to healthcare, but not a doctor. So I think it was that drive. I thought that's actually what I want to do, and luckily I had some good teachers who supported me, and I managed to get through. But there were other challenges as well. There were some incidents of racism. We had some bricks thrown through our window when I was a young child, and you have to overcome those. But I think if you've got the right parents, right drive, you can come through those things.
And did those experiences influence the ways in which your work has developed? Because obviously you do the surgical work, you work with patients, you look after illnesses that have to do with the eardrum, from what I understand. But you've also expanded that to work with the World Health Organization, with the United Nations, with a range of other parties across the globe in order to ensure that the extension of sustainable health to many other communities. What led you to do that? How did you get from here to there?
I guess part of it was part of what I've always believed in, and having those experiences when you're younger, when you don't have so much, means that of course you should recognise how fortunate you are, and that the structures that are in place that stop people progressing or stop people maximising their opportunities is something we all have a moral responsibility to look at. Mm-hmm. I think what has helped is moving into the research world gave me the opportunity to develop data and science so that I speak with some authority on what we're talking about. So in global ear disease, it was documenting the problems with ear disease, with discharging ears, the prevalence in socioeconomically deprived areas, new solutions to that. And once you come with data, then people start to listen. I've been fortunate that those people at those high institutions have listened. And the same with our supply chains, understanding and documenting the labour risks and documenting the carbon footprint of the products that we use.
And this is something I was really fascinated by. A student who comes in to study medicine might not think that if they're becoming a surgeon, for example, that actually they can deal with climate change, they can deal with equality, they can address questions around well-being that are not just physical well-being, but also mental well-being. It's quite extraordinary that you've managed to do that.
Yeah, maybe. I guess I'm interested in too many different things. I feel privileged that I can have these other opportunities, and I wouldn't say it's been an easy journey. Obviously, I've had to work hard to develop those, but it's been a real honour to be able to support those other things. I think medicine, as with many other academic areas, gives you freedom, and as long as you work hard and you find good data and you find the right people to work with, actually there's a lot you can achieve.
And from what you've said, you've obviously found the right people to work with at BSMS, the Brighton and Sussex Medical School. Are there good colleagues? Are you part of a team that does this work, or have you driven this in large parts?
There are good people, but the fields that I'm working in are completely new, if I'm honest. There was no global ear disease in Brighton and Sussex Medical School. There was no sustainable healthcare in Brighton and Sussex Medical School. So I've been fortunate that the university, the medical school, has really been open to these ideas and supported it as an ethos. And I've built a team because actually these big challenges, certainly in the younger generation, these are really the things that people are excited about and that we all want to work on.
So that one of the things I've found with students is they really want the universities not simply to teach them the subject specialism, but to begin to learn about the world in which they intervene. Have you managed to put that into your teaching practice? Is that something students could expect in medical schools in the future?
Certainly we've done that in Brighton. In our medical school, we have quite a programme on sustainable healthcare, and I talk about the labour rights harms from our supply chains, our linear economy of children working on grinding wheels to make these surgical instruments, children as young as 7, the injuries they receive, of forced immigrant labour in Malaysia, manufacturing the gloves with some of the worst working conditions we've seen anywhere. These sorts of deep-seated problems of the environmental harms, the destruction of our planet from our continual throwaway of the goods that we produce. So we've certainly embedded that into what we teach. And also, more importantly, we've given students, here's something that you can do. And that may be something from something you can do just, I will stop wearing gloves when I don't need to those who want to pursue a PhD and become experts in that field.
And if we'll go on in a moment to talk a little bit about the research that you did, but if I could just ask you a last question about those supply chains. How do you as a doctor intervene in those supply chains? Does that mean working with the different trusts? Have your ideas been received favourably by medical companies, by the supply chains that come into the trusts that you're in?
Changing structures in the world is one of the biggest challenges, but I like a challenge. So the idea and the notion has been well received in that it is very difficult to argue that morally this is wrong, what I'm trying to say. Changing the structures is more difficult, and it's about recognising who can make the change and what those changes need to be. So I have been supported. I'll be honest, it's got a lot easier lately because this is now a topic of discussion. I've been discussing these issues for 20 years. But yes, I've managed, because we've got data, because you speak with some authority, which is what academics do. Yes. You get an audience with the right people. I've worked with governments both in the UK and in Scandinavia to try and create change. We've created policy change, and in fact now, as of this year, the UK government has recognised medical supply chains as a major risk for labour rights abuses. But it needs more than that, and we need to expand this wider and wider and wider. So there's real world challenges. I'm also an advisor to the UK government on their green strategy as well. I can't tell you we've improved everything, but we're definitely getting there.
So one of the things students coming into BSMS or into other medical schools can begin to realise is that they can change the world. They can literally change the world if they identify the right things that need to be changed and done.
Absolutely. All change actually comes from one individual, more likely a group of committed individuals to create that change. We have this naive idea when I was young that these big organisations create this change. It's simply not true. It is usually a small group of people that get together and say, this is what we need to do. You speak with authority, you speak to the right people, and that is where you can impart that change.
Before we finish, Mood, could I ask you about your graduate school experience? You didn't just become a doctor, you decided to specialise. What led you to, again, were there people who said to you, you should do this? Was it something that drove you because you wanted to be a surgeon? Why not just be a doctor? What was it that drove you to go even further and to do that research? And would you encourage students now to think about those specialisms? There's a shortage of specialists in Britain, as you know.
Yes, I mean, I guess my problem is that I'm always interested in everything. So I wanted to be a surgeon because I quite liked fun stuff when I was a kid growing up. I was always fixing my bike. I liked the practical side of things. I loved dissecting during medical school. So surgery was the thing for me. And I get the problem with trying to change world policies. It takes a long, long time. As a surgeon, you can fix things quite quickly. You feel like you've achieved something. Ears is because it's complex. If I'm honest, the surgery is difficult. It even challenges me now, and I've done hundreds of ears, but I still find it challenging. But also, it links with that global health work. It links with what I would argue is the core of being human in terms of language and hearing is essence of what we do as humanity, and music as well. I grew up with music, I love music, and that's part of who we are. So that's the thing. Research, I was always down the library, I was always hungry for more, and then when the PhD opportunity came along, I wasn't sure, to be honest, because I thought, I wanted to be a doctor, and then I decided to go for the PhD. I was fortunate to get the funding. Having done it, I thought, this is a way that you can actually explore many, many other different things, and obviously I've continued on that path.
Mahmood, thank you very much. Thank you for your time, and thank you. I hope that we'll see you again soon and be able to talk about global challenges in the future.
Thank you.
Thank you.